Hi, good day. Today we are talking about peptic ulcer. Peptic ulcer is one of the most common digestive system disorders that affects millions of people around the world. It refers to open sores that develop on the inner lining of the stomach or the upper part of the small intestine, known as the duodenum. These sores are painful and can lead to serious complications if left untreated. Let's understand it clearly. The stomach produces acid to help in digestion, but this acid is very strong. Normally, the stomach and intestine are protected by a layer of mucus that prevents the acid from causing damage. However, when this protective layer becomes weak or breaks down, the acid begins to erode the lining of these organs, and that's when a peptic ulcer forms. There are mainly two types of peptic ulcers. When the ulcer occurs in the stomach, it's called a gastric ulcer, and when it develops in the upper part of the small intestine, it's called a duodenal ulcer. Now, what causes these ulcers? The most common cause is infection with a bacterium known as Helicobacter pylori or H. pylori. Another major cause is the regular use of pain-relieving medicines such as aspirin, ibuprofen, or naproxen, which can damage the stomach lining. Other contributing factors include smoking, excessive alcohol use, high stress levels, and eating spicy or acidic foods. The symptoms of a peptic ulcer can vary, but the most common sign is a burning pain in the upper abdomen, especially between meals or at night. The pain may get better when you eat or take antacids, but it usually comes back. Other symptoms may include bloating, nausea, vomiting, loss of appetite, or even weight loss. In severe cases, ulcers can cause bleeding, leading to vomiting blood or passing black, tarry stools, which requires immediate medical attention. Diagnosis of a peptic ulcer usually involves endoscopy, where a doctor uses a thin tube with a camera to look inside the stomach, or tests to detect H. pylori infection. The good news is that peptic ulcers are treatable. The main goal of treatment is to reduce stomach acid and kill the H. pylori bacteria if present. Doctors usually prescribe a combination of antibiotics and acid-reducing medications such as proton pump inhibitors. Lifestyle changes also play a big role. Avoiding spicy foods, quitting smoking, reducing stress, and limiting alcohol can help the healing process and prevent recurrence. If not treated properly, ulcers can lead to dangerous complications like internal bleeding, perforation of the stomach wall, or obstruction in the digestive tract. That's why early diagnosis and proper treatment are very important. In short, peptic ulcer is a painful but manageable condition. With timely medical care, healthy eating habits, and a stress-free lifestyle, most people can recover completely and prevent future ulcers. Take care of your stomach because a healthy gut means a healthy life.